everyone, here again with you is Upstream Health with Ify. I hope you all are having a great time and enjoying my videos. If you haven't yet subscribed to my channel, please, I need you to click on the red button that says subscribe, and also go ahead and like, comment, and share this video with your friends. There's also a bell button that you can click on also, so that when I upload a new video, you'll be the first to know. Okay, so today we're gonna be talking about cholesterol, what we call cholesterol. So I'm not gonna speak about cholesterol without you hearing me say fats or lipid. So let's look at it this way. We have cholesterol, we have triglycerides. So cholesterol, our body is able to make about 3,000 milligrams of cholesterol. We're able to make cholesterol. I think about 75% of cholesterol that we have in our body is made from our own body, especially from the liver. And then 25% of cholesterol comes from the food we eat, especially animal products. Then on the other side of fats, let's look at triglycerides. Triglycerides is another type of fat. Our body is also able to make triglycerides, and we can also get it from outside, like from the food we eat, especially from carbohydrate, the sugar we find in carbohydrate. Basically, triglyceride is processed sugar, or sugar turned into fat. So when we eat sugar and it gets into the body, it gets absorbed as fat. So triglyceride is like a transformed sugar in the body. So triglycerides, cholesterol, or let's put it this way, cholesterol is not actually considered fat, but a fatty substance, waxy fatty substance. But these two, when we want to do a workup of your lipids, in general term fats in the blood, we'll have to check the cholesterol and the triglycerides. You get it now? Cholesterol, triglycerides. Let's look at them now, group them as fat, even though cholesterol is a fatty substance but not considered as fat. So now we'll be talking about triglycerides, and we'll be talking about cholesterol. Triglyceride, which I always consider as the worst one, is transformed sugar. You get it from carbohydrate and whenever you consume sugar in the body. So with these two substances, they are not, they said they are hydrophobic, so they're not able to be transported in water. Like if we need them to get into the cells of the body, they need to go to the liver. So in the liver produces a protein that will attach to cholesterol or triglyceride. That way they make them fat soluble. So that way they're able to move through the blood and into the cells where they are needed. So why are we really concerned? Why the concern about cholesterol? You hear people say my cholesterol is high. Why are we concerned about cholesterol? So if you have heard about arterial clogging or disease of the artery, where they say the artery is clogged up, plaque building, or it's blocked, I'm going to do a little demonstration so that you will understand why cholesterol or triglyceride or fats in general is a health concern. So when the liver, when the triglyceride, when you eat, say, triglyceride in the intestine, they get absorbed and they move through an absorbable form into the blood. Same way with cholesterol. So if your body produces cholesterol, it has to move out of the liver into the blood, and while in the blood, they can circulate and go to the tissues that need them. It should be at a certain level, but when it's too much in the blood, that's when we have cholesterol issue. We talk about heart attack, stroke. Like I said, I'm going to demonstrate that very soon. But let's backtrack a little bit. In the liver, when the protein, the transporter protein, attaches to the cholesterol or to the triglyceride, we have what is called lipoprotein. So if you have done a workup, So when you do a blood workup to check your cholesterol level, you're going to hear more of total cholesterol. You're going to hear of LDL, the low density lipoprotein. You're going to hear of HDL, the high density lipoprotein, and also the very low density lipoprotein. You're also going to hear about triglycerides, right? I'm sure you guys are familiar with that and you know your number. If you're 20 years and above and you don't know your number, you need to go get your number. You know why? Because even from childhood, this cholesterol can begin to build up in our blood vessels. All right, over time, from childhood, especially where the diet is poor, people are consuming a lot of sugar, a lot of unhealthy fats, you find out that what is called plaque, I'm going to explain that later, will begin to build up in the arteries, your blood vessels. So over time, we talk about blockage. All right, so now when in the liver, the triglyceride and the cholesterol meet over there, the protein attaches to them and it's called lipoprotein. So it can able to move out of the liver and then transport the cholesterol as lipoprotein or LDL into the blood, and they go into the cells where they're needed. And that's the LDL. That is why when you hear during your test, or maybe when your primary care provider is speaking to you, they will say the bad cholesterol. I try as much as possible not to use the word bad cholesterol. The LDL usually is called the bad cholesterol because why? It transports cholesterol into the blood. It attaches to cholesterol and stays in the blood and takes it to the cell, and usually when it's too much, it stores it as fat in your fat cells. So that's the same way with triglycerides. But on the other side, we have what is called a high density lipoprotein, the HDL. We call that one the good cholesterol because what that one does is it actually goes into the bloodstream and removes excess cholesterol. So you see why the HDL is the good cholesterol, and the LDL, the one that takes the cholesterol from the liver and transports it to the blood, is called the bad cholesterol. Actually, it shouldn't be called the bad cholesterol because it's doing its work, and the cells needs cholesterol. We need cholesterol. We need cholesterol for brain health. We need cholesterol to make sex hormones, cortisol. We need cholesterol to make bile. That way you can break your fats. We need cholesterol to for like I said, brain health, for memory. We see cholesterol line up in our cell membrane. Every of our cell has cholesterol, so we all need cholesterol. So LDL, which is a lipoprotein transporting cholesterol to the cells, is actually doing its work, but it becomes a problem when it's too much in the blood, when cholesterol or when the LDL keeps transporting more cholesterol in the blood. That's when we say when we say the fat is too much in the blood. But the good cholesterol, which is the HDL, goes back into the blood, removes the excess cholesterol and takes it back to the liver. The liver can decide to store it or take it out of the system. So now you understand the bad and the good cholesterol. Okay, and then the triglycerides, like I said, are fats. They are stored as fat in the body, so you don't need too much of triglyceride. Your body is able to make, like I said, 75% of cholesterol in your body is made by your body. 75 made by your body, 25 comes from outside, from the food we eat. Same also with triglyceride. So what is the problem now? Why are we concerned about cholesterol? Why the issue? Why the noise about cholesterol? So I'm going to quickly demonstrate that with you. I tried getting something to make it easier, but I'm going to make do with what I have, and I hope this helps. Okay guys, welcome back. So why should we be concerned about cholesterol? Why should we be worried when the doctor says your cholesterol is high? Excuse me. So cholesterol has been shown to be a risk factor for cardiovascular disease. Let me make it simple. So cholesterol is one of the culprits that you find involved in heart attacks, stroke, vascular diseases. So when you hear about someone having a stroke or a heart attack, cholesterol is one of the problem, not major, one of the problem. And we all know that heart attack or cardiovascular disease in general is the #1 killer disease we have. So that's why you should be concerned with your number. So let's look at the science behind or the anatomy of the heart and how it works with cholesterol. So I brought this. I don't know if you can see this. This is a water bottle. I'm sorry, I have to make do of what I have. So let's say this is the blood vessels. Okay, this is the blood vessels. Your blood is supposed to be pumping freely through here, going to wherever it's supposed to go, say to the heart, to the brain. This is your heart here, right? And this, let's say this is a major artery, a major blood vessel. Artery is a blood vessel. So let's say like a pipe. Your artery is like a pipe. So blood should flow freely to the brain, to the hands, to the stomach, the kidney, to the legs, to the, if you watched my video about erectile dysfunction, it has an artery. Blood should be flowing freely to the penis so that you can have erection. Blood should be pumping freely, going freely to the heart so that you'll be able to pump out blood to the rest of the body, right? Freely. You see how free this blood vessel is? Let's say this is an artery blood vessel. You see how free? Blood goes whoop, whoop, and it goes freely. So like for the heart, at rest, just like the way I'm sitting right now, your blood at every minute, at every 60 seconds, pumps out like 5 liters of blood with a heart rate of 60 to 100. So as I'm sitting here, I should have a heart rate of 60 to 100 and pumping out every minute, every 60 seconds, 5 liters of blood. And that is because my artery is free of blockage, flowing freely. Say if I'm exercising or if I'm doing a vigorous work, you see my heart rate will go up above 100 and I should be producing blood like over 10 liters
over
per
10
second,
liters per minute,
because this blood vessel needs to be patent. It needs to be open for blood to move freely. So why are we talking about this? So let's bring cholesterol. So the understanding is over time, even from childhood, the food we eat, our behavior like smoking, alcohol, the food we eat, maybe inactivity, we're not active, we're not walking around, or maybe not exercising, and other medical chronic condition can affect the opening of this artery. You see how it's so open? And usually the lining of your artery is called endothelium, right? It's a smooth muscle. Usually it should be able to like constrict this way and then dilate, means open. Constrict and blood will squeeze and then dilate, open. So it's supposed to be constrict and then open. That's why it's a smooth muscle, like an elastic band, right? So that nature of your artery gives it that ability to, you know, adjust through pressure, pumping blood. But if anything affects the lining or the elasticity of your artery, anything that affects it can affect how the structure of your artery. It can narrow this artery, make it smaller, right? You can make it smaller, and that way it will affect blood pressure. It can affect the way blood flows here. So where does cholesterol come in? So if anything damages this, think about too much of cholesterol, too much of LDL, the one we call that carries the cholesterol, too much of it. So too much of cholesterol can damage the walls of this artery. Smoking can damage the walls of this artery, right? Too much of alcohol can damage this. Inflammation, remember we're always talking about inflammation. Foods that are inflammatory can damage this. So think about it. When the walls of this artery gets damaged, then metabolic waste, let's say like calcium, cholesterol, they can all come here and begin to attach themselves, because this smooth muscle is no longer smooth. It's been damaged. And for this vessel to be able to dilate and, you know, dilate that way, expand, we have nitric oxide. Remember my video when I talked to you guys about food that helps with that boosts nitric oxide? So things that can destroy nitric oxide, because your artery needs nitric oxide to dilate, to open properly so that blood can, you know, move in freely. So anything that destroys nitric oxide will destroy the lining of this artery, of this blood vessel. Okay, so like smoking is one major one. Metabolic syndrome, remember our metabolic syndrome: inflammation, high blood, uncontrolled blood pressure, diabetes, too much glucose can damage this. So when this wall gets damaged, then cholesterol, the LDL, deposits here. So over time they begin to deposit. So let's say this is cholesterol and other substances like calcium, metabolic waste, not just cholesterol. That's why I said it's not fair when we call LDL the bad cholesterol. It's not only the culprit. We have calcium also, and we have other metabolic waste. We have every other thing causing this, right? So let's say this is cholesterol and other metabolic waste. So what will happen if over time this deposit fills up here? So do you see that the width or the opening of this blood vessel reduces? So over time it builds up in the artery, and then it can occlude this vessel. I wish I have something to demonstrate that for you. So let's say it builds up so much and then it blocks this. That's where you hear about a massive heart attack. All right, over time, when this cholesterol, waste products, deposits in the artery, it stays here over time, and a lot of reaction like oxidation, foam cells. Over time, it can, like when the blood is trying to force itself, it can break off the plug, like the deposit. So that break off can travel and go block the heart vessels, or go block one of the carotid arteries going to the brain, or block somewhere. Remember erectile dysfunction, that plug can block off those little arteries that goes to the penis, and then you don't have erection. That way it blocks the carotid artery, you get the stroke. It blocks the coronary artery, the artery that goes to the heart, and the person gets a heart attack. So you see why it's concerning that we should have our cholesterol under control. So not just cholesterol. So like I said, don't always freak out when you see numbers. There are other things that needs to be checked. Okay, there are other things that needs to be checked. In the next video, I'm going to speak about the treatment pathway and foods that you can incorporate in your daily diet to help bring down your cholesterol, or put your cholesterol and triglyceride, majorly triglyceride, under control. Your triglyceride is very important. Triglyceride, we want it to be below 150. And we have the LDL, we want it to be below 100. Some people want it below 70 based on depending on their risk factors for stroke and heart attack. And the HDL, which is the good cholesterol, again, for women, we want it to be about 50 and above. For men, about 47 and above. So those are the numbers. I need you to know your numbers. And I'm going to speak in the part 2 of this video about the treatment pathway for high cholesterol or high triglycerides, and then foods that you can incorporate. Okay, see you in my next video.